Hello everyone. Today we are going to discuss about care of patient with low immunity or immunocompromised patients. I'm Ms. Jansi, tutor working at Triple M College of Nursing. Let's see what are the objectives of today's session. At the end of the session, the listener will be able to define what is immunity and elaborate the aspects to keep in mind while caring for immunocompromised patients. Definition. So this is the immune system response. So weakened immune system that is unable to fight pathogens, lacks sufficient white blood cells or antibodies. Infection control measures include hand hygiene, personal protective equipment, and isolation precautions. Okay, understanding the immunocompromised status. First, educate the patient and family about implications of low immunity and importance of adhering to the safety measures. So first, what are signs of infection? Instruct the patient to report any signs of infection such as fever, chills, increased heart rate, or unusual fatigue. What comes next is nutritional support. We have to be very cautious about the nutrition, what they are getting. So we have to give them a balanced diet. Keeping it in mind, encourage a nutritious diet rich in vitamins and minerals to support immune system function. Foods high in protein, vitamin A, C, and D, and zinc are particularly beneficial for these patients. Hydration. Ensure adequate fluid intake to prevent dehydration, which can further compromise immunity. Moving on to the medication management. Adherence to the prescribed regimens. Be strict with what is being prescribed, including any antibiotics or immunosuppressants. Don't skip or avoid any medications. Monitor side effects. Observe for potential side effects of medications that could further weaken the immune system or lead to infections. Environmental considerations must be kept in mind, that is, clean environment. Maintain a clean and organized living space free of dust and potential allergens. Avoid crowded areas. Advise the patient to avoid crowd places and limit exposure to sick individuals, especially during flu season or outbreaks of the infection. Okay. Moving on to the regular monitoring. Make sure vital signs, especially temperature, to detect early signs of infection. Lab tests include regularly to check CBC, to assess immune function and identify any changes in the white blood counts. Activity and rest is very important. Encourage gentle exercises to promote light physical activity as tolerated to maintain strength but avoid overexertion. Adequate rest is to be ensured so the patient gets enough sleep to support his or her recovery and overall health maintenance. Keeping psychological support in mind, emotional well-being is very important. So provide emotional support to address their feelings of anxiety or fear about their condition. Encourage discussions about their feelings and concerns. Have an open-end questions. Support groups. Suggest joining support groups for patients with similar conditions to share experiences and coping strategies while they are fighting with this immunocompromised state. Moving on to the coordination of care. All the healthcare personnel are involved in the care. So collaborate with healthcare providers, including dietitians, social workers, specialists, to create a comprehensive care plan tailored to the patient's needs. So all work in hand. Moving on to vaccination. Ensure that the patient is up to date with vaccines as recommended by the healthcare team to prevent preventable infections. Live vaccines may be contraindicated, so consult with the physician regarding appropriate immunization regimen before taking one. Fine. So report when these symptoms arises to a healthcare personnel or to a nearby hospital. Blurred vision or eye problems, trouble in concentrating, ongoing fatigue, rapid or irregular heartbeat, rash or hives, new cough, sore throat or white patches or sores in the mouth, pain or burning when urinating, skin cut or sore that swells, turns red, feels hot or painful or begins to ooze, fever that is above 100.4 degree Fahrenheit or higher or with rigor, and diarrhea that does not go away after two loose stools, pain or cramping in the belly. When all the symptoms arises, you have to immediately seek for medical attention. Hope you cleared with the topic. So these are some of the references. Thank you.